Welcome to Nursing School Explained and this video on the oxygen delivery system non-rebreather mask. Whenever we talk about oxygen, we have to keep in mind that room air, the air that we just breathe every single day, contains about 21% oxygen. So if the patient now, for whatever reason, requires more than that, then we have different delivery systems available that we can use to increase the oxygen that the patient is getting. And the simplest way is a nasal cannula. When that is not sufficient, usually the next way up is the non-rebreather mask. And it looks like this. So it is a mask and it has a reservoir bag attached here. The strap goes around the patient's head and the hookup goes to the oxygen, whether that's a wall unit or the oxygen tank. And then this reservoir bag, before you put the mask on the patient, make sure that you hook it up to the oxygen source and that this bag fills up quite a bit before you put it on a patient, because this reservoir bag will now contain the oxygen that the patient is breathing. And it is called a non-rebreather because, as you can see here, there's a little valve attached here, and this valve makes sure that the exhaled oxygen does not go back into the valve but goes out so the mask right here, and then there's another valve right here, this little paper thing on top of the reservoir bag that actually allows for no air to enter, for no exhaled CO2 to enter into the reservoir bag. Now let's look at this in more detail here. The non-rebreather mask we can set up at the oxygen outlet for 6 to 15 liters per minute, which then allows us to administer to the patient 70 up to 100% FiO2, and that's up quite a bit from 21%. So that patient usually requires a lot of oxygen for a short term until something else can be established, whatever other delivery system that the patient needs at that time. And then it is the only non-invasive device that allows for the administration of the 100% FiO2. Other than that, we only have the endotracheal tube, where the patient actually has to have a tube inserted and have certain medications to keep them sedated. So this is the only device that allows us to administer 100% FiO2 non-invasively. It is a little bit less comfortable because it is a mask that covers the nose and the mouth, and it is loud because the oxygen administered at 6 to 15 liters can be quite loud because the kind of the sizzling noise that it makes. Now, as for our nursing care, we need to make sure that we have a snug fit, because otherwise the oxygen is just going to leak out the sides of the mask and the patient is not going to get the FiO2 that we want to administer. We also want to make sure that we assess the skin frequently, because any kind of contact of the mask with the skin of the face or behind the ears can certainly be concerning for skin breakdown. We also want to set the flow rate high enough to keep that reservoir I showed you on the bag at least 1/3 to a half full during the inhalation. Otherwise, it's going to be empty and the patient is not going to be getting the additional oxygen that they need. And like I mentioned before, it's usually for the short term until some other more definitive oxygen delivery system can be figured out, so the patient that keeps them more comfortable and or delivers more or less oxygen depending on the situation. Thanks for watching. Please also check out the other demonstration videos where I actually show you how to hook up those different oxygen delivery systems. Thanks for watching.